How can I treat wrinkles around my eyes?
Wrinkles under and around the eyes inspire people to spend a lot of money on solutions from miracle creams to medically based procedures. The specific reasons for different types of wrinkles determines how those wrinkles are actually treated. I'll discuss the way I help my patients who come in concerned about wrinkles under and around the eyes. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I specialize in cosmetic procedures of the eyes and eyelids and treating the signs of facial aging, ranging from advanced techniques such as upper and lower eyelid surgery, injectable treatments around the eyes such as cosmetic fillers, platelet-rich plasma, and Botox, as well as lasers and radiofrequency technologies for the treatment of eyelid skin. Many people first recognize signs of aging around their eyes. This includes wrinkles just below the eyes to crow's feet lines that appear when smiling or squinting. We face people every day with our eyes, and the eyes are the first thing that we see when we look in the mirror. The appearance of your eyes can project an impression to another person in a fraction of a second. And that fraction of a second, they'll get the impression that you're tired, even if you're not, or older than you really are. So it is natural to want to refresh the appearance of your eyes and diminish the signs of aging and tired-looking eyes. There are two basic types of wrinkles around the eyes. Static wrinkles, which appear when the face is at rest, or with no expression, and dynamic wrinkles that appear when smiling or other facial expressions. Treating these two different types of wrinkles need two separate approaches. Wrinkles are one of the most noticeable aspects of an aged appearance. While there are more significant causes of facial aging, such as loss of facial volume from bone loss and sagging as skin and underlying support gets weak, wrinkles are what most people see when they look at themselves and conclude that they are aging. There is a common misconception that under-eye wrinkles are caused by excess eyelid skin. Patients will sit in front of me and pull on their lower eyelid skin and believe there is excess. In actuality, this stretchy characteristics is more the result of a decrease in skin quality and facial volume loss. Nonetheless, well-meaning doctors often try to address the under-eye wrinkles during lower eyelid surgery by actually removing skin. In my opinion, this is not the best treatment for wrinkles under the eyes. The skin shortage can actually pull the eyelids down, making the eyes look rounded and hollow. Under-eye wrinkles are most commonly caused by collagen loss, not excess skin quantity. So treatment should be about improving the eyelid skin rather than removing it. Lines that appear around the eyes with facial movement expression, such as those commonly known as crow's feet lines, appear due to muscle activity. Collagen loss and breakdown, as well as constant creasing of the skin, make these lines appear prominently even at rest. Since movement causes these lines to deepen, limiting movement can help diminish those lines. Wrinkles under the eyes are treated by improving lower eyelid skin quality. This may involve heating devices such as lasers or radiofrequency technology applied with precision to stimulate the body's collagen production. The body produces collagen in a response to controlled injury, so applying heat as well as removing parts of the layers of the skin, as in the case of ablation, is a specialized type of controlled injury. Increased collagen in the lower eyelid skin makes the skin look thicker and healthier. In addition, removal of the top layer of skin cells allows new and fresh layers of skin cells to emerge. It is important that heating and ablative devices are not overused, as too much heat energy or overaggressive ablation can cause the skin to actually become thinner. Collagen stimulation is not limited to the application of thermal energy and laser devices. Collagen production and increased blood supply in the lower eyelid skin can be stimulated with a regenerative treatment called platelet-rich plasma, or PRP. Platelet-rich plasma is a concentration of the platelet component of the blood, which is responsible for healing when you have a cut. PRP is a concentration of the wound-healing growth factors that can also stimulate collagen and stimulate more blood supply to the under eyelid skin. PRP can also be used to help people with skin discoloration under the eyes, commonly known as dark under eye circles. To reduce wrinkles around the eyes that appear with movement, the treatment approach would be to reduce the movement and reduce the cause of these wrinkles. This movement can be reduced by limiting muscle activity, such as with neurotoxins such as Botox, Dysport, or Xeomin. Reduced movement makes the lines appear less deep. An artistic and experienced touch with injectable neurotoxins is important so that natural movement and facial expressions are not affected. With time and regular treatment, lines and depressions in the skin caused by constant muscle contraction progressively improve. It is important to understand that wrinkles around the eyes cannot be completely eliminated. The goal here is to improve or to reduce the wrinkles. As is often seen in some well-known people attempting to completely erase lines and wrinkles that ultimately result in a frozen, expressionless face, that does not look natural. Lasers and radiofrequency may take a day to a week before people are able to go back to work. The healing process, which is going on below the surface, is characterized by continued collagen production and remodeling. PRP can be placed below the skin as well as in the upper layers of skin and can have anywhere from no downtime to a day or two. Neurotoxins like Botox and Dysport take about 3 days for effect and 2 weeks for full effect. It is routine for our patients to go back to work right after treatment. When it comes to lines and wrinkles under and around the eyes, I always discuss aspects of lifestyle with my patients. Simply said, anything that's not good for your health is not good for your skin. Poor diet, smoking, and excess sun exposure, or the use of indoor tanning beds with ultraviolet light accelerates loss of collagen. I also discuss strategies for keeping the skin looking good for the long term through regularly scheduled treatments and skin products such as sunblocks and cosmeceuticals. In the modern world, people are constantly being bombarded by irresponsible messaging from the internet and television. Hype for products and procedures results all too often in people having poor outcomes and permanent skin damage. A lot of people make the mistake of having procedures based on coupon offers to save money or from having procedures from inexperienced practitioners only to spend more money and time trying to repair their overtreated or damaged skin. I recommend to find a doctor who you can trust to have your best interest in mind and be your guide to navigate through all of the messaging before you undergo a procedure. In my practice, I provide my patients with a treatment plan with an understanding of what to expect with the procedure that I've recommended and an ongoing dialogue. I hope you found this information helpful. Thank you for your question.